Hi, I'm Priyanka Sharma, a professor of medicine from the University of Kansas. I'm here at ASCO 2025, and we're presenting data on association of ImPrintTN signature with survival outcomes by race in basal subtype triple-negative breast cancer. This is an analysis from the FLEX registry. This data used real-world FLEX registry to look at the association of ImPrintTN with self-reported race and survival outcomes in early-stage genomically blueprint basal-type TNBC. And just as a way of background, ImPrintTN is a 24-gene immune classifier signature, which currently is being evaluated in the I-SPY 2.2 trial. This analysis included 279 patients. 66 out of them were Black and 213 white. And again, these are self-reported races. Race was not associated with PCR, but imprint positive status was associated with PCR, as you can see on this bar graph here. ImPrintTN status was associated with recurrence-free survival, as you can see on this Kaplan-Meier curve here, with three-year recurrence-free survival at 77.5% in ImPrintTN negative and 87.9% in ImPrintTN positive population. Similar proportion of Blacks and whites were ImPrintTN positive. Race by itself was not prognostic for recurrence-free survival. You see similar recurrence-free survival in Blacks and whites. On a multivariable analysis, imprint status maintained its prognostic impact on recurrence-free survival. When we break down the impact of ImPrintTN on recurrence-free survival by race, what we see is in patients who are ImPrintTN positive, the Blacks and whites are doing similarly well. In a subgroup of ImPrintTN negative patients, there's a numerical difference with Blacks doing worse compared to white. Of course, the numbers are small, so statistically this is not significant. So to our knowledge, this is the first study to report the prognostic impact of imprint on survival outcomes in patients with triple-negative breast cancer. And what we show is the Black and white patients with basal TNBC had similar proportions of MammaPrint high 2 tumors, and ImPrintTN positive cancers were numerically higher in Black patients. ImPrintTN status was predictive of PCR and independently prognostic for recurrence-free survival. Ongoing research efforts will focus on exploring biological differences within the ImPrintTN negative subgroup by race, and updating this analysis as the FLEX registry enrolls more patients who have received chemoimmunotherapy for triple-negative breast cancer. All of this cohort was recruited before chemoimmunotherapy became standard of care for triple-negative breast cancer. Thank you.